It could be just me. I'm already feeling the burn.
Really?
I absolutely.
It's only at a 1.
In fact, I'm already smelling the burn. You know, all I have to say is thank God my workouts are on tape. No one can doubt me. Because if you're not using the gym enough, or if you're eating too many donuts, or working out and having donuts, anyway, or maybe buying cartons of cigarettes, your doctor's going to know about it, all about it. Talk about creepy, right? Hospitals now tracking your every move. Orthopedic surgeon Scott Barbour says this goes too far. How can they do this, Scott? What's going on?
Well, Neil, first of all, thanks for having me on. But basically what hospitals are increasingly trying to do is use data brokers to use your consumer information about where you purchase cigarettes or what gym memberships you buy, or if you pick up too many candy bars at the checkout corner.
But how would they know that, doctor? I mean, that's what how do they get privy to that?
Well, basically, there are data brokers like LexisNexis that can sell this information to hospitals, and they can purchase that data and get it out there. In addition, you know, as part of the Obamacare, they're increasingly forcing doctors to include certain pieces of information in your medical record. And although they say that these medical records are secure, you know, we've seen that the government has had trouble maintaining this information. They just lost 2 years of Lois Lerner's emails.
Well, there is that. You know, doctor, what I also worry about is that, to your point, slipping into the wrong hands. It's one thing for my doctor to have it and then lecture me about the donuts and all of that, but it's quite another when someone else gets their hands on it, and it sounds like it happens and can happen quite easily.
Right. Well, you know, right now they're saying that the data is going to be used so that they can proactively intervene in your health care and help you have better health care. But the problem is that data can also be used against you. You know, in Obamacare, our reimbursement to hospitals is increasingly being linked to outcome assessments. And so hospitals are trying to define which patients are higher risk and lower risk, and ultimately that could be used to influence who gets care and who doesn't get care. And so it's a real slippery slope, and it can be a dangerous situation. You know, the doctor-patient relationship is extremely important, and it's predicated on trust, and patients want to believe that their information is private.
Man, oh man, because that's the nanny state on steroids. You know, it's one thing for, you know, one person to lecture me, but now I'm going to get everyone and his uncle lecturing me, right?
Well, you know, and another thing is you're really only collecting part of the data. You know, whenever you assess a patient, you want to collect as much information as a physician so that I can help the patient make the best decision regarding their health choices going forward. But when you just get a piece of information here or there, it doesn't give you the whole story, and so you can come to erroneous conclusions. And we see that in healthcare all the time. You know, back in the age of antibiotics, we started noticing that children were dying from cancers, right. And we initially attributed that to pesticides, and what we later found out was antibiotics were just causing more children to survive later so that they could suffer from those cancers. So, you know, gathering information is important. It can be helpful, but when you use it to the exclusion of everything else, it can be used for nefarious purposes. And I, for one, am a firm believer in privacy and maintaining the doctor-patient relationship.
Very good. Your alarms well noted. Thank you, doctor. Good seeing you again.